Hello, I'm Dr. Tim Cantopher, consultant psychiatrist and author of the book Overcoming Anxiety Without Fighting It. I'm going to talk today about a malady which affects literally billions of people worldwide, that is anxiety and anxiety disorders. I'm now retired, but during the course of my clinical career, the patient who I saw over the longest period on and off was Jane. Jane came to see me from time to time in order to tell me about the myriad of symptoms from which she suffered, all physical symptoms, and all of which she was sure would kill her, representing, as she knew they did, cancer. In fact, they didn't, and they didn't kill her. But the great sadness was that Jane never, during the time she saw me, really accepted any specific treatment for her anxiety. She talked about it, but she didn't really accept any treatment, which is a great sadness as treatments work. Jane eventually stopped seeing me. Then about 5 years later, her husband was kind enough to get in touch with me to tell me that sadly Jane had passed away. She had died of cancer. Now, the sadness is that it wasn't the disease which killed her, which really robbed Jane of much of her life. It was her anxiety which stopped her living the life which she would have wanted for so many years. So what is anxiety? Well, that's easy. It's fear. Fear is a normal emotion and a necessary one. Without it, we wouldn't avoid danger. We would walk into a busy road without looking where we're going. We might get onto a railway carriage or in a train full of drunk football supporters, and we might sit next to them and tell them that they shouldn't drink so much. So now either of these activities are incompatible with your ongoing physical health. So avoiding these behaviors is crucial, and anxiety helps us to do that. Fear helps us to do that. But if fear dominates every moment of our lives, through its degree and its effects, then we're suffering from an anxiety disorder. This graph, which hopefully you can see now, is the Yerkes-Dodson curve. This demonstrates the other main purpose of anxiety, which is to allow us to perform. At zero arousal, you can call it alertness, but I would call it arousal. At zero arousal, you're asleep, so you can't do anything. As you just wake up, you can only do basic things. Your performance improves as you become more and more awake and aroused, and eventually you reach a plateau. You can increase your level of arousal further, but your performance won't increase any more than that, but it won't deteriorate either, until suddenly, very suddenly, you reach a precipice. And just a teeny bit of extra arousal or stress than that, and you will completely dissemble into a state of panic in which you can't do anything. Now, there are various forms of anxiety, and they have a lot in common with each other. Now, I'm not going to talk about obsessive compulsive disorder here, though almost certainly it is a form of anxiety disorder, but it's a big subject which deserves its own talk. First of all, there's generalized anxiety disorder. This is where you are fearful to a degree which interferes with your day-to-day functioning all the time or much of the time. Your fear leads to a range of physical symptoms, and that's because anxiety involves the fight-flight response. This is the body's response to perceived danger. So if you are on the primordial plane, it makes a great deal of sense, if you perceive danger, for you to be able to run very fast, or to fight very well. In order to do this, you need to pump lots of blood around your body so your heart rate increases. You need to become breathless to load up with oxygen. Your muscles need to go into a state of tension, ready for a fight to the death. Your bowels may empty out from both ends in order to make you lighter so that you can run faster. All of your senses and all of your nerves will become super sensitive because you're going to need every possible acuity in order to deal with this life-threatening situation. Now, this is extremely effective if you are on the primordial plane being chased by a saber-toothed tiger. But if you're in an ordinary contemporary situation, it's unlikely to be so helpful, and it's likely to be experienced as a very unpleasant sense of fear. And this is what happens in anxiety. The scariness of the physical symptoms, normal though they are and healthy though they are in the short term, cause the second type of anxiety disorder, that is health anxiety. Now, it was this type of disorder that Jane suffered from, and it blighted so much of her life. You become totally preoccupied with your physical symptoms, and you fear the worst for them. They take over your life. So am I saying if you have a variety of physical symptoms caused by your primarily by your anxiety, that it's all in your head? No, I'm not. And that's because there is no division between mind and body. Your physical symptoms change the way that you think, and your thoughts and your anxious thoughts cause physical symptoms and bodily changes. So there's a circular event happening here. These physical symptoms of anxiety are also central to the third type of anxiety disorder, which is panic disorder. In this, you are not suffering from overwhelming anxiety for much of the time. You're certainly able to function for much of the time, but from time to time, either for no reason at all or in response to certain cues, a sense of overwhelming panic and all the symptoms which go with it overtake you, and you become unable to function. There is a vicious cycle which occurs here, because it's so unpleasant when a panic attack happens that you develop a fear of fear. And so you can bring on your panic attack not by necessarily any events or cues, but just by thinking about and fearing having one. So there's a vicious cycle which happens here as well. And because it's so scary and unpredictable, you will tend to avoid anything which reminds you of any cue or anything which reminds you of your last panic attack. So avoidance is also the main factor generating the next type of anxiety disorder, which is phobic anxiety. If you've been bitten by a dog, all you need to develop a phobia of dogs is to avoid them for a while. So avoidance is clearly crucial in maintaining many types of anxiety disorder. Now, phobias are contextual as well, of course. If you have a phobia of spiders and you assiduously avoid them, living in the UK, you suffer from arachnophobia. If you avoid spiders and you are living in Australia, you're very wise. So in dealing with anxiety, and phobic anxiety in particular, we clearly need to think very logically about the situation which we face. But of course, that's very difficult when you're consumed by overwhelming fear. And this gives us a bit of a clue as to what we need to do in treatment. We need to get from the overwhelming emotion to thought and logic. Approaching what we fear needs to be done in a very planned, gradual and persistent way. This is the basis of behavioral psychotherapy and cognitive behavioral therapy, which I'm going to come to shortly. Gradually approaching your fear is also central to the last type of anxiety disorder, which is social anxiety, also often called social phobia. Underlying this is a fear of how we'll react and how we'll perform and how we'll appear in social situations. So Tom has a fear of social contact, but nonetheless he's about to go on a first date. He's very fearful because he thinks that he's going to embarrass himself, because his physical symptoms such as blushing, breathlessness, having to rush to the toilet, stammering, all of these he's sure are going to be very clear, and they're going to embarrass him because the lady who he's going to meet is clearly going to see how anxious that he is. Now, because he's so scared of this, and because these are all normal symptoms of anxiety, his fears may well be to an extent realized. When this occurs, he's going to engage in a lot of self-criticism, and this self-criticism is a trauma to him. Beating ourselves up for what we think is foolishness or being pathetic or not as good as we should be is very stressful, and it causes a lot of suffering. So this trauma that Tom puts himself through, the trauma of self-criticism, is going to cause him to avoid any situation like this in the future. And so again, we have the central role of avoidance. Tom's fear of social situations will get greater and greater the more he avoids them. So as you can see, there are a lot of common threads here in terms of what underpins the various anxiety states. And therefore the same treatments tend to work to a greater or lesser extent for them all. So what can we do about anxiety? If anxiety dominates your life and prevents you from leading the life which you would want to, please go to see your GP and do this now, because treatments work and your GP can arrange them for you. But if you are referred for specific psychological treatment for your anxiety, you're likely to go onto a waiting list. And this may be for a matter of a week or two, or it may be for quite a lot longer than that. So get into treatment as soon as you can. Fortunately, there's a lot that you can do while you're waiting. First, change something. There's an old saying that if nothing changes, everything remains the same. And this is certainly true about anxiety. Change something. My guess is that you're probably somebody who rushes around trying to please everybody all the time. You need to change that balance. Now, I'm not saying that you should completely flip to the opposite and become a very selfish person. As you can see from this figure, the two opposites of anything are very close to each other. What's really different, what's the radical and stable difference, is the center. You're looking to move from one extreme, not to the other, but to the middle ground. So start to try and change some of those things which are specific about you, particularly those things which tend to exhaust you. Move to the middle ground. Change your relationship with failure. My guess is that you tend to beat yourself up horribly whenever you get something wrong. And that's why you tend to avoid doing those things and becoming more and more afraid of them. So embrace failure. If you fail at something, it means you've tried at it. And that, to me, is a triumph. The immediate result is irrelevant. What's crucial is that you continue to try. Because if you do, eventually you're going to succeed. Pace yourself. Most of my patients didn't pace themselves. They exhausted themselves. They tried to do everything at 1,000,000 miles an hour. Now, life is a marathon, not a sprint. And the winner of a marathon does not run the first mile in 4 minutes. Otherwise, he or she is not going to win. So pace yourself. Do things gradually at a pace which is not punishing to you, but be consistent. And consistency, by consistency, I mean persevering at things, but I also mean avoiding double standards. Another of my guesses about you is that you are much more critical of yourself than you are of other people. You expect much more of yourself, and you're much more harsh to yourself than you would be of toward anybody else. Now, that's a double standard. That's not consistent. So I'm not saying that you should treat yourself specially, but I am saying that you should treat yourself as well as you would a good and loving friend. Challenge your habitual thinking patterns. Now, almost certainly, you tend to have a negative view of yourself, the world, and the future. This is characteristic of people suffering from anxiety, and these thinking patterns need to be challenged. So talk about the way you tend to think about yourself, the world, the future, with wise and kind friends or family, and let them challenge the way that you think. This is, after all, the basis of cognitive behavioral therapy, which I'm going to come to. There's no harm in starting now. Practice a relaxation exercise. Now, I'm not going to go through a relaxation exercise with you today because there isn't time. But there is an exercise in each of my books. There are also apps, or you can do yoga or transcendental meditation. Whatever exercise you do, whatever relaxation exercise you do, first of all, practice it regularly. Practice it for half an hour every day, certainly to begin with, and make it a priority. If you hear that an asteroid is about to strike your town and vaporize it, then by all means run for the hills, but not until you've done your relaxation exercise first. Be realistic about it. Relaxation exercises are a complete waste of time to begin with. They don't work because you have to learn the skill. So practice and practice and practice, and recognize that it's probably going to take 1 to 3 months before these exercises are of any use to you, but persevere and they will change your life. Keep going with them. I persevered with the relaxation exercise and it changed my life. It took me probably a year or so to get good enough at it, maybe even 2, to get as good as I am now, where I can switch on a relaxed state in about 10 seconds. But I can tell you it changed my life. It got me through medical school, and I wouldn't be here talking with you now unless I'd become an expert at it. So go into detail about the elements of the relaxation exercise. As you will see, if you read any of my books, there is visualization is a crucial aspect of a good relaxation exercise. So let's imagine that you're on a Caribbean beach. You're imagining yourself there. Well, that's very nice, but it's not enough. You need to be able to smell what hot sun on sand smells like. You need to be able to say whether the sand is soft or hard and smooth or lumpy, what the sound of the waves is like, what the color of the sea is like, what the soft drink which you're drinking tastes of, how far back the grass starts, those tall palm trees, are they coconut palms, or are there small stumpy palm trees. The coconuts, are they brown or are they green? You see, you need to be there in every sense and in detail. And it's that detail which allows relaxation exercises to work. So get started with one. Take moderate aerobic exercise. Nothing heroic, but something that gets you a bit out of puff each day. It's very effective. Moderate aerobic exercise has been found to reduce anxiety in just about everybody. Reduce your consumption of caffeine and alcohol. Now, don't do this very suddenly if you drink very heavily and regularly, but do gradually cut down the amount that you drink. If you do, you may well feel a bit more anxious to begin with because you're not used to drinking less, but over time, your anxiety level will fall. And this is crucial. If fear is holding you a prisoner, then list your fears. Make a list of all of your fears, from the most severe and terrifying to the only slightly fearful situations, and list them in order of their fearfulness. And then start at the bottom and have a little go at trying to approach the thing which you're afraid of. But as I say, only at the bottom of the hierarchy, and then very, very slowly and methodically working your way up the ladder of feared situations. This is called systematic desensitization, and it underpins behavioral and cognitive behavioral therapies. And it involves reciprocal inhibition, which means you can't both be anxious and relaxed at the same time. So before you do the thing which you're afraid of, practice a relaxation exercise first. And keep going with this process. Use problem solving as a way of life. Now, this diagram represents it, this cartoon represents it. Problem solving means taking one gigantic problem and breaking it down into lots of smaller ones, as many smaller problems as you can. And then for each smaller problem, brainstorming possible solutions, the silly as well as the serious, and those that won't work and those that will, and then weed out those that won't work and that you don't like, and come up with an action plan which you take action on one at a time in a slow but consistent and methodical way. This is problem solving, and you can get started with that principle, starting to approach your problems slowly and methodically. Practice thought stopping. Thought stopping is a technique which involves experiencing some sudden impulse, some sudden sensation, like a loud sound, for example, and then putting it into your memory bank, and then imagining that sudden sound when you're ruminating anxiously. This sudden impetus will give you a few seconds to escape the circular thought patterns which you're engaged in, and instead starting a relaxation exercise. So practice a thought stopping technique. Most important, work on becoming more mindful. Now, mindfulness is based on Buddhist philosophy. The principles are staying present and experiencing your environment as it is, rather than spending your time worrying about stuff that has happened in the past or what may catastrophically happen in the future. Experiencing what is happening right now. If you came into my consulting room when I was practicing, I would ask you what colour are the flowers outside the door of the hospital. If you don't know, then you're not being mindful, because you're thinking too much about what you're going to say in the appointment, and you haven't been experiencing the sensation which was available to you at the time. So being present and experiencing what is around you. Engaging in acceptance, not fighting things which you don't need to fight. Don't fight uncertainty, unfairness, imperfection, or your symptoms. Accept them and experience them. Now, There are many books on mindfulness. One particularly good one is called Mindfulness, A Practical Guide to Finding Peace in a Frantic World by Mark Williams and Danny Penman. There are some good apps. One is called Headspace and the other is called simply Calm. Check them out. Mindfulness is a very powerful technique. So I've touched only briefly on some of the things which you can do yourself. And there are more things which you can do in my book, Overcoming Anxiety Without Fighting It. So the therapy you get may well be based on mindfulness, which I've already talked about, and your therapist will take you through the practicalities of experiencing life on its own terms, staying present and accepting rather than fighting. An offshoot of mindfulness is called Acceptance and Commitment Therapy, or ACT for short. That acronym can equally stand for accept where you are, choose a direction, and take action. So in ACT terms, what you do is more important than how you feel about it. Choose which way you're going to go and commit to it. Or your therapy may well be based on cognitive behavioral therapy. Now, the cognitive bit means identifying the unhelpful thinking patterns which you've been engaging in for a long time, digging a bit further for the deeply held underlying assumptions which generate those unhelpful thoughts, such as I'm no good, it'll all go wrong in the end, it'll all be a disaster, etc. Then challenging those thoughts and assumptions in a very structured way. The behavioral bit means changing the way that you act. Your therapist may well get you to engage in behavioral experiments, which means testing out a different way of viewing your situation and seeing if it works in the real world. Coming back to your therapist the next week and describing what happened, and then modifying the way that you think about things as a result of the new evidence. So above all, your therapist will help you to work on avoidance, slowly, in a very structured way, asking nothing of you that can't be done, but getting you slowly to shift in the way that you need to. All of these therapies have a wealth of evidence behind them. Your therapist may engage in exploratory psychotherapy with you, used to be called psychoanalysis, but it's less likely because these analytical or exploratory therapies take longer and therefore are less likely to be used under the National Health Service. But it's possible that you may get this form of therapy, particularly if there is clear trauma and difficult events and emotions from earlier in your life which underpin your anxiety. Whatever form of therapy is recommended for you, go for it. Now, I'm briefly going to talk about medications. I've found that people have very black and white views about medications for anxiety, either that they see them as poisons or that they see them as panaceas. Well, they're not panaceas and they're not poisons. Medications can be very helpful, particularly at the beginning of therapy. If you are so terrified of your anxiety that you're unable to engage in the therapy, then bringing your level of anxiety down for a little while with medications can help you to engage in the long-term solution through psychological therapy. The serotonin-specific reuptake inhibitors, SSRIs for short, like Prozac and Seroxat and Lustral, these are effective drugs for anxiety, but they can cause an initial worsening. For the first week or two, your anxiety can get worse. If you can cope with a slight worsening of your anxiety for the first couple of weeks, then persevere with it, because eventually it will help. If, on the other hand, you're terrified and the worsening is awful, then go back to see your GP, and there may well be something else which you can tolerate. But these drugs, you must take them regularly. They make you worse if you take them intermittently. And when you stop them, do so under the guidance of your GP and gradually. The benzodiazepines like Librium, Valium and such drugs, these drugs work very fast and they tend to be effective, but because they work so quickly, there is a risk attendant on them of addiction. So they're used much less nowadays, except maybe for the first week or so in order to allow a longer acting drug to get into your system. Beta blockers, these are drugs such as propranolol, which reduce the physical symptoms of anxiety and can be helpful, and they're not addictive. They should be quite helpful in health-related anxiety, reducing the symptoms as they do. In practice, they tend to have, for a lot of people, quite disappointing results in health-related anxiety, but if they work for you, great. Anti-epileptic drugs such as pregabalin can be helpful and have a low addictive potential, so they can be helpful for some. But whatever drug your GP recommends for you, go for it and persevere with it, especially if your anxiety is so severe that you can't immediately engage effectively in psychological therapy. Now, I'm not going to talk about herbal medicines here, not because they don't have any effect against anxiety. Some of them do, but they are generally less efficacious than pharmaceutical preparations, and they don't have the wealth of evidence or safety testing behind them, so I wouldn't recommend them. Alternative treatments, there are many of these, but these tend to be arts rather than sciences, not with a strong evidence base. And asking me about alternative treatments, therefore, is like asking a painter and decorator about a Leonardo da Vinci painting. He'll tell you there's a lot of paint on it, but won't be able to say much else that's of use. So I'm not really going to engage in a discussion of alternative treatments either. But so this has been a whistle-stop tour through the area of anxiety disorders and their treatment. But I want to leave you with one thought. However severe your anxiety is, treatment can be effective. So seek treatment, go to your GP, persevere, make some changes in your life, allow yourself to fail, act to yourself as you would a kind and loving friend. Well, okay, that's more than one thought, but if you can start to do those things, you can make a great start toward conquering your anxiety. Well, now, thanks for listening. If you have any questions, please put them in the comments feed to this video, and I'll get to as many of them as I can. There are, in fact, 2 questions which have already been asked of me by Sarah. She asks, what would you recommend to people who have started feeling safe in lockdown and are now anxious about going back to normal? Well, this is about the process of systematic desensitization, isn't it? You know, if you have been necessarily avoiding social contact because of the lockdown, and now you have to go back into social contact, you're going to find it more anxious making than you did before. So don't do it very suddenly, do it slowly, and that's a good principle anyway. And be thoughtful and kind to yourself as you do it, but do gradually get back into social contact. Don't become a recluse. Sarah's second question was, what can we do if we feel anxious about being around people who are not wearing masks or not wearing them correctly? Well, this is where, of course, anxiety is your friend. If you're fearful of people who are not wearing masks, you should be. They're dangerous. Avoid them. Avoid people who are stupid or selfish because they're no good for you. And there are plenty of good and sensible people out there who are not going to put you at risk. Okay, well, thanks again for listening. I hope this talk was of some help, and please do read more detailed material, either one of my books or somebody else's, or something online. Thanks very much. Bye-bye.